try and get a couple of questions in here. Carolyn, this question first dropped in during your segment. It is open to all of our speakers as well. And it's just asking, how can I tell the difference between normal work-related stress and distress in a colleague that might require intervention?
I get asked that question every time I do a program like this. It's very interesting. And certainly the clinicians on the call should feel free to jump in. But what I have found, in doing these programs and speaking to clinicians is, when there's a change, when, you are working with a colleague or a client and, they're stressed, they talk about their stress, and things are kind of moving along in the same way versus a change, late for appointments, sounding more agitated, easily more angered. It's some of the red flags that I outlined. Again, when there's a change from, what you're used to seeing or hearing, I'm told by the clinicians, and I have seen in doing these programs, that leads us to being concerned that we're moving from normal stress into distress and possible, mental health challenges.
Thank you so much, Carolyn. And Mark, this question dropped in during your segment. I think you may have actually answered it towards the end of your presentation as well, but it just asks, are there any resources to help someone find out what providers are out there?
I think there are, there's a patchwork of resources. I think your local Lawyers Assistance Program can provide some guidance. There's some publications like Psychology Today that provide some guidance. If you go to your local hospital systems and you look at their mental health providers list, it is a difficult question because a lot of times you'll go to your insurance company or your insurance list. What you'll find is a lot of providers are either not accepting new patients or are no longer covered by insurance. One of the best sources really is to get a referral from an existing healthcare provider who could even in some instances help get you an appointment quicker. But there's not a great network in my view of here who the providers are, here what their specialties are. There's a lot of trial and error, and that's why access to care is such a big issue.
Thank you so much, Mark. And Terry, a quick question for you here. The answers that did come in related to the percentage of the legal community, if you like, that were suffering from alcoholism. When you asked that question earlier, it was relatively low. What I wanted to do is just ask, how do you think the rates of alcohol problems in lawyers compare to studies on physicians, and why do you think lawyers may have a higher rate of alcohol problem within the community?
It's a good question. There was a comparison. They used a version of the test they used on the lawyers on the physicians 2 years earlier. And if I remember, the lawyers were had almost twice the rate of problems based on purely consumption habits, not looking at consequences. As to the why, I'm not sure. My one theory is it is an adversarial system. And I've heard someone say that when you're in the operating room, everyone in the room is trying to save the patient. You don't have one doctor trying to save the patient and one doctor trying to kill the patient. So that difference, working on collaboratively on teams may be better than our adversarial system for the mental health. That was my one. What was the other reason? I had a second thought, but I lost it. So that's my one. Adversarial system might be part of the reason. Isolation is huge in the legal profession. I'm not sure how that compares to the medical profession.
Thank you so much for that, Terry. And Doris, this final question, it dropped in during your segment, but I think it may have been discussed by some of our other panelists as well. But I was just wondering if you'd be able to close out the presentation by answering this question here. And the question was, what are some effective coping mechanisms that people can implement when dealing with the isolation of the COVID-19 pandemic?
Very good question. I think if you have access to technology, using Zoom to keep in touch with people. My family had a Zoom Thanksgiving this year, and it was hilarious. We didn't think it would be very good, but we had a great time. Staying connected by watching movies, not the news all day long, but movies or books outside of your profession that distract you from, your worries. This summer, with some of my neighbors, we would gather outside in my backyard with chairs separated apart to just socialize with some iced tea and stay in touch. So telephone calls, FaceTime, any way that you can see another human face is my recommendation.